All right, welcome everyone to our What's Buzzing today with Stamps Health Services. Dr. Ben Holton is joining us today to learn about the variety of health services available to Georgia Tech students, giving an overview of a lot of different things. And in the interest of time, because you all may have some really great questions for him, I'm going to hand it over to you, Dr. Holton. You can further introduce yourself and get us started.
Good afternoon, everyone. As Ms. Brownlow said, my name is Dr. Holton. I am the Senior Director at Stamps Health Services, and I have been here for 14 years here at Georgia Tech and in the role of Senior Director since 2017. And I appreciate this opportunity to talk with you and just share a little bit about stamps and what we do and hopefully can answer any questions you have. So I'll go ahead and get started. So just to start off with, this is a description of the services that we provide here at Stamps. Primary care clinic is our largest clinic and sees the largest volume of patients. Primary care, we see patients for students for kind of acute illness, acute injury. So this is where your student's going to go if they have a sore throat or cough or abdominal pain, nausea, vomiting, diarrhea, things like that. It's also where they're going to, the clinic they're going to go to if they have an acute injury, if they sprain their ankle playing soccer, or they fall on a scooter, or things like that. Women's health clinic is for our female patients, and we see a variety of things there, including acute issues such as discomfort with urination or abnormal vaginal bleeding or irregular periods. We also offer a full spectrum of contraceptive technologies for students. And we have the capability of doing point of care ultrasound there to help us assess any issues a student has. Our psychiatry clinic we have 6 psychiatrists, and they are here to help students address mental health illnesses that require treatment with medications. The counseling center is a separate unit that is not part of Stamps. That's where students can get talk therapy, but we partner with them pretty closely since many of the students that we see in psychiatry here are also getting counseling through the counseling center. One of our providers has an interest in men's health, so sees students for things related to the male genital area, including dysuria, discharge, things like that. That our provider in men's health also sees a lot of our students that request PrEP treatment and things like that. We have 3 providers who are trained in sports medicine, and they are really here to help take care of our students that have sports-related injuries, whether those occur out on the athletic field or in the CRC, lifting weights or anything like that. Our travel immunization allergy clinic, we do travel visits for students who are going to be going abroad to help them assess whether they need immunizations to protect them from illnesses while traveling, whether they need medications to prevent illness such as malaria, prophylaxis, something like that. And we do offer allergy shots in our travel immunization allergy clinic. We don't do allergy testing. A student has to go see an allergist for that. But once they've seen an allergist and that allergist has prepared their serum and they've had a couple of shots at the allergist office and haven't had a significant reaction, we will continue their allergy shots here at Stamps. And then we offer the broad array of immunizations that students need, either the ones they need for enrollment or the immunizations that they need for travel. We do have an in-house pharmacy here at Stamps. It functions as an outpatient retail pharmacy, just like CVS or Walgreens. Student does not have to have their prescription written by us to fill a prescription here in our pharmacy. So if they see a provider in the community or at home, that provider can send the prescription to our pharmacy here, and the student can get it filled here. In our pharmacy, we do accept outside insurance. So if they're on your insurance plan, they can use that insurance plan to fill their prescription here. We also offer lab and radiology services in the building here. Our lab does some tests here, such as a complete blood count, a strep test, a mono test, a urinalysis, a pregnancy test, a COVID test, flu test. And then labs that we don't do here are sent out to Quest Labs. And typically we'll get those results within 24 hours. Some tests take a little bit longer, but the vast majority of them we get back the next day. We also have a multidisciplinary eating disorder team that's comprised of primary care providers, our psychiatrist, our care coordinators in psychiatry, also the nutritionists that are part of the Wellness Empowerment Center are part of that. And we have some representatives from the counseling center that join us for that. We also provide medical direction. One of our sports medicine providers provides medical direction for the athletic trainers that are going to be in the athletic training center in the CRC. That athletic training center is targeted toward non-varsity athletes. So the students that are playing club sports or intramural sports will be able to utilize the athletic training center in the CRC, and we're partnering with them to provide care there. The Wellness Empowerment Center is also located in our building. They're not part of STAMPS, they're a separate unit. But we work closely with them. They provide health education. Our nutritionist, we have two nutritionists that are in the Wellness Empowerment Center that meet with students, and our sexual assault victim advocates, which are known as voice advocates, are also located in the Wellness Empowerment Center here at STAMPS. So who are we? Who are our staff? So we have 15 physicians on staff, and those physicians are board certified in several different fields. Some are certified in internal medicine, some in family medicine, some in emergency medicine, in psychiatry, OBGYN, and 3 of the providers that are board certified in family medicine also completed fellowships in sports medicine and are certified in sports medicine. We have 5 nurse practitioners, 2 of whom are in primary care, and 3 of them are in women's health. And we have 3 physician assistants. All of those are in primary care. Our staff has 6 nursing RNs. Our pharmacy has 3 PharmDs. Medical assistants support our providers in medicine, in primary care, and in women's health. 3 care coordinators in psychiatry. These are like case managers, and they support the psychiatrist in providing care to students, helping students get connected with resources across campus and off campus if those are needed. We have 6 staff members in the lab and radiology area, and about 15 support staff in administration and business, IT, and other support roles. In total, STAMPS employs about 70 people. So I wanted to talk briefly about the health fee and contrast it with health insurance. I want to make sure that parents in particular are clear about these 2 things, because we have had instances where students ended up going to a local hospital and thought that their care at that hospital would be covered by the health fee that they pay to Georgia Tech. And I want to make sure that it's clear that the health fee is not health insurance, and it won't cover care outside of STAMPS. So every student pays a health fee. It's one of the mandatory fees that they pay with tuition, and students cannot waive out of that health fee. Currently, that health fee is $139 for fall semester, $139 for spring semester, and I think $90 for summer semester. That health fee covers only care that's delivered at Stamps Health Services. It can't be used outside of Stamps. It does provide 68% of our operating revenue. And with that health fee, students get an unlimited number of visits with a provider in primary care and women's health. So it does not cost a student anything to come and see a provider in primary care or women's health. We don't charge a visit fee for that. It provides 6 visits in psychiatry. It does cover some of the lab tests that we do in the lab. So labs such as a strep test, a mono test, a urinalysis, a pregnancy test, and STI testing, including gonorrhea, chlamydia, and HIV testing. We don't charge for those. They're all covered by the health fee. Students can get a flu shot at Stamps, and that's covered by the health fee, so we don't charge students for that. And x-rays are covered by the health fee, so the students don't incur a charge if they come and get an x-ray. And that includes the reading by the radiologist. So all of our x-rays are read not only by our own staff, but also by a radiology service. The health fee does not cover prescriptions in the pharmacy, so that's why we do accept outside insurance in the pharmacy. And there are lab tests that it does not cover that students will incur a charge for. And vaccinations other than the flu test, there's a charge for those as well. Georgia Tech does offer a student health insurance plan. That plan is through United Healthcare. It is mandatory for a subset of students. So students who are on an F or J visa, graduate students who have a graduate teaching assistantship or graduate research assistantship, it's mandatory for those. Those students that fall into that mandatory category can waive out of the student health insurance plan if they have an alternative plan that meets the criteria for waiving out. The advantage of the student health insurance plan, at least in terms of receiving care at Stamps, is that if a student does have a charge that's not covered by the health fee, the student health insurance plan will cover that charge at 100%. So there's no copay at Stamps for those students who have the student health insurance plan. If they use that student health insurance plan outside of Stamps, it functions just like any other insurance plan. So there is a copay and co-insurance, but that's not true at Stamps. As I mentioned, this health insurance plan is through United Healthcare. So it's a national company, and the plan does provide coverage outside of the Atlanta metro area. And the plan is actually a plan offered through the University System of Georgia. It's not just a Georgia Tech plan. So all of the schools in the University System of Georgia offer this same plan. We do strongly encourage that students have health insurance. It's not a requirement at Georgia Tech or in the state of Georgia. But we do strongly encourage it, either the student health insurance plan or being on mom and dad's insurance plan or a plan through the insurance marketplace. So a little bit about our operations. We are open year round, except for the week between Christmas and New Year's. We do not close during spring break or fall break or even winter break, except for that week between Christmas and New Year's. And actually, the whole university is closed for that week. So other than that week, we're open all year round. We are open Monday through Friday, 8 to 5. We do alter our hours a little bit during the summer. We close 30 minutes early during the summertime, but 8 to 5. We are appointment based, so we do ask that students make an appointment for care if at all possible. Appointments can be scheduled in primary care, the travel immunization allergy clinic, and women's health by going online through the patient portal. You can schedule appointments. Psychiatry appointments are scheduled through the Center for Mental Health Care and Resources, which is also known as the Counseling Center. And we do have a process for students that walk in without an appointment. They can ask to be seen by a nurse who will do a triage to determine whether that student needs to be seen urgently, or meaning we fit them into the schedule, or they will be assigned or scheduled for the next available appointment. We do reserve those walk-in appointments only for urgent or emergent issues. So if a student falls on a scooter and they have road rash, they're bleeding, they have a laceration that needs to be repaired, something like that, we'll fit them in into the schedule. We'll see them. We're not going to turn them away. But as a general rule, we do ask that students schedule an appointment to be seen. And I did want to just talk briefly about FERPA and HIPAA. FERPA is the law that governs the release of educational records for students in institutions of higher education, and HIPAA is the law that governs the federal law that governs the release of medical records. For the most part, the care that we provide falls under FERPA. And under those two federal laws, your students are considered adults if they're 18 or older, which means that we cannot disclose the care that we provide to them or disclose their medical records without their consent, even to you as their parent. Having said that, we strongly encourage students to communicate with you if they are having a significant medical issue. If we're sending them to the hospital for something, the first thing I'm going to ask is, do you want to call mom and dad and let them know what's going on? And we'll try to have a conversation with you and just make sure that you're aware of what's going on, what our concern is, and kind of what the plan is. Now, so we're not here to keep you in the dark. If there's something significant going on, we will strongly encourage your student to make sure you're aware of what's happening. But we can't do that without getting their consent. So just wanted to kind of let you be aware of that, and that's a requirement by law. Just so you are aware of kind of the numbers, it shows the unique patients seen in FY24 and FY25, and then total visits in FY24 and 25. So in FY25, which ended in June this year, we saw 11,500 unique patients, meaning we saw 11,000 patients at least once in one of the clinics at Stamps. We saw a total of 34,000 visits here at Stamps in FY25. 19,000 of those were seen in primary care, 2,000 were seen in men's health, 5,000 in psychiatry, 2,500 or 2,700 in women's clinic, and about 4,000 in travel, immunization, and allergy clinic. We stay pretty busy. We see 150 to 200 patients a day here at the clinic. And I just want to talk briefly about how Stamps is financed. We are financed entirely by student fee dollars and by revenue that we generate from clinical activity. And the largest source of that revenue in terms of clinical revenue is our pharmacy. So when a prescription is filled by a student in the pharmacy, that's a source of revenue for us. We do not receive money from the Institute for operations. So Georgia Tech doesn't provide us money to operate, except for the student fee dollars that students pay. Our largest expenses are our people overhead that we pay to the institute. So we pay the institute for services such as IT services and uh, human resources services. We help support salaries in campus services and in the student engagement and well-being unit. And then we also have significant expenses in our pharmacy. Just want to let you know of a couple of things that we've accomplished in the past year. So we are in the middle of a renovation of the second floor of our building. We're actually nearing the end of that renovation. We're expanding our women's health clinic, doubling the number of exam rooms available to provide care to our women students. It will also enable us to add a provider in women's health. Our building was, we first moved into this building in 2003. And at that time, women made up about 28, 29% of the student body at Georgia Tech. At now, women make up around 45% of the student body at Georgia Tech. So the number of women on campus has expanded greatly. And not only has the percentage of women increased, the total number of students on campus has increased. So in order to meet that demand for care for our female students, we've had to expand the space available to provide that care. We should receive our certificate of occupancy for that space in the first week of November, and we hope to resume providing care in the new space starting at the beginning of spring semester. We have also invested significant effort in improving the process that students go through to provide us evidence of having met the requirements for immunizations. So we implemented a couple of new tools that help us get the documentation that we need for in-state students. So students that reside in Georgia that received their immunizations in Georgia, they actually don't really have to submit any documentation because we are able to download their immunization records from the state of Georgia immunization registry, and that automatically gets imported into our electronic medical record for the student. All the student has to do, in-state students, all they have to do is do an online tuberculosis screening. And when they complete that, they've completed their immunization compliance process. And we will review that and make sure that all the requirements are met, and we'll let them know if there's something that they need to do. For students from other states within the United States, we can also download immunization records from those individual state registries. But the student does have to tell us which states they've received immunizations in. So they have an extra step. They have to tell us which states to query for their records. And then they also have to do the online TB screening. For international students, they have to provide us paper documents that show their immunization records. And that is the same process that we've had in place for a long time. So for in-state students and for students who had their immunizations done in other states within the United States, we've streamlined the process to get their immunization records in. And as a result of that, we have been able to reduce the number of students who had an immunization hold placed on their account. We reduced it between the fall of 2023 and the fall of 2024. We cut the number of students who had an immunization hold placed by 41%. And we're on track to reduce that by another 50% this fall. So we've made a significant dent in the number of students who have had difficulty providing us with documentation of their immunization records through the new tools that we've implemented. We think that's been a beneficial thing for students. It's also been beneficial for our staff as well. Last slide, just some contact information. Our phone number for stamps, the general phone number for stamps, 404-894-1420. And our website is listed there as health.gatech.edu. And then my email, benjamin.holton@health.gatech.edu. And my office number is listed there as well.
Awesome. Thank you so much, Dr. Holton. We do have quite a number of questions, so I'm going to start you off. And I know probably some folks joined us after we began, so these may be a little bit of a repeat, but possible. First question is possible to get flu shots for students at GT?
Absolutely. In fact, we are in the middle of our flu shot campaign. We've already had through three flu clinics here at Stamps, and we have two more scheduled. One next Tuesday, and then the one in the last week of October as well. And we also we actually right now, some of my staff are over in the student center in the food court giving flu shots as we speak. So yes, absolutely, they can get flu shots here, and they're free. They don't get charged for it.
And how can students, I guess, learn about where to get those, what day, like just visit your website, or what's the best way?
So it's on our website. We have yard signs all over campus that list the dates. The dates are listed they went out in the Daily Digest, which is a campus-wide email that goes out. They're on the campus calendar. They went out in the student newsletter that comes out of student engagement and well-being. So
A
they've
variety of ways.
a variety of ways.
Yes, exactly. Awesome. Next question is, my daughter wants to get a blood test. How does that work? Does she need a doctor's order?
So a couple of ways. One, if your student has an order from their doctor at home, they can bring that into us. We'll typically schedule an appointment for them with one of our providers so that that order can get put into our electronic medical record, so it can be sent to our lab. Or sometimes the nursing staff can do that for them, or one of the sometimes they'll bring it to me so that I can put it in. And then they'll just have to come to the lab, and we'll get that blood drawn and sent off to sent to the lab. And we typically communicate those test results to the student through the patient portal.
Perfect. Another question. About a month ago, my daughter was very sick and went to Stamp's website to schedule an appointment, and she was only able to schedule for about a month out. She ended up going to urgent care off campus. What should a sick student do? Can they just walk in?
So a couple of things about scheduling online. For one, we open up appointments in primary care 3 days ahead of time. So at 7 o'clock every morning, a new set of appointments open up. So one thing is to kind of time when you're looking for an appointment. If you go early in the morning to the website, you're more likely to find an appointment. Also, particularly if you go on a Monday, Tuesday, or Wednesday, there'll be more appointments available, especially 2 or 3 days out. However, if you can't find one online, it is possible to walk in if you're sick, and we will a nurse will triage the student and see if there's something going on that we need to fit in on an urgent basis. We do have a provider that's designated as the walk-in doctor each day, and we can fit them into that schedule if it's an urgent issue.
Great. And I think you already spoke to this, but just kind of reiterating, what types of radiology services are provided and is the radiologist on site?
We just do plain film, so we don't have access to CT or MRI. So we can do an X-ray, just a regular X-ray. Our radiologists are not on site. We contract with a radiology reading service, so they read our films remotely, and they transmit their report to us through the electronic medical record. Our providers are quite comfortable reading X-rays ourselves, and we do the initial read ourselves. So, I mean, my typical practice is I pull up the X-ray in the exam room with the student and kind of walk through the X-ray. We have our X-rays are viewed electronically, so I can pull them up in any room, and we can show it to the student. And say, if we're concerned about a fracture, I can say, here's where you're hurting, and you can see or not see whether there's a fracture there or not, or we can look at the X-ray and say, no evidence of pneumonia, that sort of thing. But our radiologists are not here on site.
Got it. My son, freshman, has issues with scheduling at the website, or a lot of times all the windows are grayed out. Are there instructions on how to use it?
So if I'm not sure why the options would be grayed out. The only thing I can think of is early in the semester, we sometimes our electronic medical record has not yet received notification from Banner, which is the system that the university uses to store student information. Sometimes we don't get notified that a student is eligible for care here at Stamps from Banner. They haven't paid a health fee, or we've not been notified they paid a health fee or something like that. And if a student doesn't show up as eligible, their ability to schedule an appointment is not visible to them on the patient portal. In that situation, if they come in and walk into the health center, we can schedule an appointment for them at the front desk. But that by this point in the semester, that should be resolved. And if your student is still encountering that problem, have them come in so that we can look at their patient portal and try to figure out what's going on.
Great. In which months do kids get more sick for cold and pollen related issues?
Um, every fall semester, we see lots of upper respiratory infections. And, students come to campus and they bring their viral infections with them, and they share their viral infections with each other. And oftentimes, it's viruses that they haven't had exposure to before, and so we see a lot of viral upper respiratory infections in the fall. Spring, it calms down a little bit. Every semester, we see a spike in COVID activity at the beginning of the semester, and that was true this semester. Even we're still seeing COVID activity on campus, and the beginning of each semester, we see a little spike. Flu season for us typically falls in January and February. We have had a flu season that happened in December a couple of years ago, but typically it falls in January and February. And then for those of you who live in the Southeast, you know that March is the beginning of pollen season. And April is where it's really heavy. And so that's typically our allergy season, March, April, May.
Yeah. Are flu, stomach issues, and or fever or any of those things considered urgent enough for a walk-in?
So if a student is comes in and they're having vomiting, active vomiting, that is someone that we would typically fit into the schedule. If they come in and say, yeah, I had one episode of vomiting last night and I've been able to eat and drink all day long, maybe not, but if they're actively vomiting, we're not going to send them out. We're gonna fit them in. We're gonna get them some medicine for the vomiting, assess whether they're dehydrated, do they need some IV fluids or something like that. And the same is true for diarrhea. Um, Fever, if they come in and they have a fever on presentation here, we're going to typically present them or fit them into the schedule to assess that. So yes, in general, those would be things that we would fit into the schedule.
Got it. Do you offer physical therapy services?
We do not have physical therapy here at Stamps, but we can refer students to physical therapy and help them get connected with physical therapy. There are two or three physical therapy places near campus. One's right across 10th Street from campus. If you're familiar with the campus, there's a donut shop on the north side of campus that's kind of well known, and it's in a strip mall, and there's a physical therapy place right there in that little strip mall, definitely within walking distance, and there are a couple of other places nearby as well. So we don't provide it here, but we can get students connected to it.
Perfect. What happens if a student has an emergency over the weekend? What should they do?
So we do list after hours care locations on our website. If it's during the weekend or in the middle of the night, we recommend students go to urgent care or the nearby emergency departments. The two hospitals that are closest to us are Emory Midtown Hospital and Piedmont Hospital. Emory Midtown is literally within walking distance from the east side of campus. It's two blocks from the stadium, and Piedmont is not much further away.
Okay, great. How do we find out information for UHC insurance?
So if you go to our website, which is health.gatech.edu, there is one of the tabs, I think is health services or services for students. And we have a web page that's all about the student health insurance plan. It describes the kind of what the plan is, and it includes a link to the United Healthcare plan that is specific for Georgia Tech and provides instructions for enrollment and that sort of thing.
Great.
And we also have one of our staff is our insurance coordinator for the student health insurance plan, and she can also answer questions about the student health insurance plan. And that webpage has her contact information as well.
Okay. Does Stamps provide annual wellness checkup and recommended vaccinations? If yes, are they 100% covered?
We do provide routine physical exams and we can provide vaccinations as part of that. So the routine physical exam is covered by the health fee, so there would not be a charge for that to see the provider. If there are vaccinations that need to be done other than the flu vaccine, there would be a charge for that vaccination. But the physical exam itself, there is not a charge for.
Okay. Um, my son is an international student. He got the flu vaccine in another country in June of this year. Should he get vaccinated again with you?
Uh, it would depend on whether that flu vaccine that he received in June was last year's flu vaccine or this year's flu vaccine.
Mhm.
And that would depend in part on what country he received the vaccine in, he or she received the vaccine in. Um, Typically, I would say it would be a good idea to get an updated this year's flu vaccine, even if they had one back in June.
Okay. I think this is, I'm gonna try to make sure I understand this question. Charges associated with Stamps Health Services, not fully covered under the mandatory GT health fee will be charged to the student's own health insurance plan, not GT, not GTSHIP, a plan, or student's GT account. If that makes sense. Charges associated with Stamps Health Services are not fully covered. So they're asking, are they not fully covered under the mandatory GT health fee? And they'll be charged to the student's own health insurance plan.
So we do not file insurance other than the student health insurance plan for medical charges. So if the student has lab work that is not covered by the health fee and they incur charges for that lab work, the student will have to pay out of pocket for that. We will not bill their insurance for that. We do bill outside insurance in the pharmacy, but not for medical charges. So the student, that will go on the student's account if they have charges that for things that not covered by the health fee, other than prescriptions.
If a student's roommate is diagnosed with flu or COVID, something like that, does GT provide quarantine isolation services? What are the options for a student whose roommate is diagnosed with some sort of infectious illness condition?
We do not provide quarantine or isolation, separate space for that on campus. We did that during COVID in 2021, 2022, but we no longer do that. In that situation, the students need to, we instruct them to wear a mask, to kind of take the normal hygiene practices such as covering their mouth and nose when they cough, wash their hands, that sort of thing. But we don't provide isolation space.
Can a student get a blood test without a prescription on campus?
They cannot just walk into the lab and request a blood test. They have to have an order for that. And that has to come from a physician, either written by an outside physician or by one of our own physicians or providers.
Okay. So step one would be just to see the doctor and then go from there.
Yes, I mean, and if it's ordered, if a outside physician has ordered that lab test, they can present with that order and we can get that order into our electronic medical record system so that the lab can be done, but they do have to have an order from some provider.
This is from actually a student. I'm an international student and I have paper documents about all my immunizations with me. Can I get a Gardasil 9 vaccine on campus or how does that work?
Yes, we do offer the Gardasil 9 vaccine, and you can get that done through our travel immunization and allergy clinic. You would just schedule an appointment there, and we can start that process for you.
Perfect. This may have already been answered, but just to reiterate, does Stamps accept any insurance as well as pharmacy plans for things that are not covered by health fees?
In the pharmacy, yes, we take outside insurance plans for medical charges, labs, vaccinations. We do not file any insurance plan except for the student health insurance plan.
And then another question, a parent, kind of a comment and I'll make it into a question. Could there be more allowance for more sick appointments to be scheduled within one day? Feelings like sick students need priority over appointments that can wait. 3 days seems a bit long to wait for an appointment if sick.
Yeah, we're working pretty diligently to try to make appointments available to students. We do have a process for students to walk in if they're acutely ill to try to get them fitted in. We have been a little bit constrained this fall with space because of the renovation on the second floor. Women's Health is operating out of space that would normally be used by our primary care clinic, and that's impacted the number of the amount of space available to primary care. So we're hoping that more appointments will open up once we're able to move Women's Health back up into their space. and have a little bit more space for primary care to operate. We're also doing, one of the challenges that we face is that students schedule an appointment and then don't show up for their appointment. And that's actually enough, that happens enough times each day to equal one provider's schedule. And so we're doing some things to try to reduce that, the frequency of that happening. One thing that we've implemented is we've always had email reminders of appointments where we've implemented a system of sending text reminders because we know that students do more texting than email. But students have to opt in to receive the text messages as opposed to email. Students' email address is generated by Georgia Tech, so we know what their email address is. We don't know what their phone numbers are unless they provide those phone numbers to us. And the regulations around texting are that you have to opt in for it. So we need students to opt in to receive text messages. So that's one of the measures that we're taking to try to make sure that students keep their appointments so that those spaces are utilized and don't go unused. We're also doing some other things to try to reduce those numbers as well.
Can you speak to any dental or vision offerings?
Sure. So we do have a dental clinic in the building with stamps. It is not part of us. It is an outside dentist that leases the space from us. But they do see students and they do accept the student health insurance plan as well as accepting other dental insurance plans. So they are available for students to schedule into. There is an optometrist in the student center called Depot Eye Center. They again are an outside practice that has an office here on campus. $35,000 of the health fee each year goes to the optometry practice on campus to help provide a discount for those services to students. So that is available to them on campus. They are not in our building and they're not our staff, but that is available to students on campus.
Okay. Can a patient get a referral to a cardiologist for pre-existing condition?
Absolutely. So we have a list of providers that are in the Midtown area or in the Atlanta metro area that we can refer students to if they need that specialist care. And so we can certainly help a student get connected to a local cardiologist.
So kind of in the same vein, are there any ENT specialists at Stamps that students can make an appointment with, or is that a referral?
That would be a referral. We do not have ENT specialist here,
Okay. Um,
but we can certainly help a student get connected to a nearby ENT physician.
great. Um, just had another one pop in. Please clearly explain for which services our personal insurance is considered because um, it was just said that we won't use your personal insurance and bill gets added to the kid account. I just got confused. Sorry for having to
Yeah.
ask again. Yeah.
So the only place we accept outside insurance is in our pharmacy for prescriptions. Um, the student health insurance plan, we accept both in the pharmacy and for medical charges. But outside, mom and dad's insurance plan is only accepted in the pharmacy.
Okay. All right. And oh, another one just popped in. My daughter has already filled the health information, including immunization records during application to Georgia Tech. Should this be repeated into your clinic again, or do you access information from that source?
If Georgia Tech itself does not collect immunization information. So if your student submitted immunization information, that was into our system. We're the only place that gets submitted at Georgia Tech. So that should, if she did that, then that came to us.
Okay. And we'll take just a couple more and then we are going to sign off and probably pop that contact information back up for maybe these remaining questions. But a couple more. If my son is an international student, how can we know what it covers out of how can we know what will be covered out of our insurance, I suppose, is what they're saying.
So if your student is an international student and they're on the mandatory student health insurance plan because they're on an F or J visa, you can find the plan documents by going to the link on our website for United Healthcare, and that will include the plan documents that describes what's covered by the insurance plan. The student health insurance plan, if they're on the student health insurance plan, any care they receive at Stamps is covered 100%. But that plan document will describe what's covered if they go outside of Stamps. Um, I, I think that answers the question.
All right, final one. This is kind of a follow-up to the vision and dental. Can the student schedule dental and vision appointments through the Stamps portal? If not, how does the student schedule these appointments?
No, the dental appointments and the vision appointments would not be scheduled through our patient portal. On our webpage, we have links to the dental practice is called Tech Dental. We have a link to their webpage, and you would schedule appointments through their webpage. And DePoe Eye Center also has a link. I'm not sure if I guess they do have appointments, and you can schedule through that. Otherwise, you can just walk into their area that's located in the student center.
Perfect. Would you mind sharing that contact slide one more time if you are able? Um,
Sure.
and while he's doing that, thank you all for such great questions. Lots of lots of great questions today. Just wanted to pop that up, just as we close, knowing that, you might think of a question after today, or maybe I didn't see your question or it wasn't answered, exactly how you were hoping or understanding. So we just wanted to be able to provide a way for you to be reached back out. Of course, this is being recorded, so we will work on getting this recorded, uploaded, back to where you saw this advertised in the Hive. Hopefully no later than close of business on Friday is always our goal to send it out in the same week. So be on the lookout for it there in the next few days. And of course, in the Hive, you can always ask a question and I can pop that over to Dr. Holton as well for him to answer. But thank you, Dr. Holton, for your time, your energy, your enthusiasm for what you do, and just the comprehensiveness of this conversation. I think it was needed and very much appreciated. So thank you so much for joining us.
You're very welcome. And thank you for the chance to talk.
Of course, of course. Families, thank you for being here and listening from all the different places that you carved out for your day to listen to us. So I hope you have a great rest of your day, and we'll see you soon. Go Jackets.
Go Jackets.
Bye, everyone.